So there have been several key innovations in hematology in the last 60 years. I mean, there's dozens, if not hundreds of things that have happened, but just to touch on a few significant things, I think that we've come a very far way in terms of genetics. We've got to the point where we can not only pinpoint genetic mutations or chromosomal abnormalities that can cause hematological disorders, but we're at a point now where we can look at subtle variations in the genome that can, that we can associate with a variety of hematological disorders. And by identifying these subtle variations, we can then either identify patients who are at risk of a certain condition, and we can also tailor our medical treatments towards those patients. Another innovation that has taken place in the last 60 years is the management of sickle cell disease. Now, sickle cell disease was first described in the early 1900s, but in the last 60 years, we have developed a variety of tools to help manage patients, such as using transcranial Dopplers to assess cerebral blood flow in patients with sickle cell disease. We now use prophylactic antibiotics to prevent patients from getting bacterial infections because they're usually hyposplenic. And now we're at a stage where we're also using genetic tests to identify patients at risk of complications with sickle cell disease. So I think we've come a long way in terms of that. Another thing that we've really done in the last 60 years is to do with blood transfusion or transfusion medicine. We've now developed specific factors, factor 8, to treat patients with hemophilia. And this is something that has really revolutionized the treatment of patients with this disorder. And tying into that, we have an exceptional blood transfusion service here in the UK. So we can give patients derivatives of whole blood. For example, we can give red cells to patients not just with hematological disorders, but those who've been involved in surgery or traumatic car accidents. We can give fresh frozen plasma, we can give cryoprecipitates, and we can give platelets for patients who are at risk of bleeding. So I think that we've come a really long way in terms of treatment. And then lastly, we're in the era of immunotherapy or targeted therapies. So we still use chemotherapy, which is cytotoxic, meaning that it kills a lot of cells in the body. But now we can specifically target patients who have aberrant cells that are causing either malignant disease or non-malignant disease. For example, rituximab has revolutionized the care of patients with lymphoma. Imatinib is a drug used to prevent patients with CML from getting acute leukemia. So we now live in an age where we can actually give targeted therapies and actually extend the lives of patients for quite some time.